Hello, my name is Ryan Crawford, and today I'll be discussing my research paper titled The Effectiveness of Visual Strategies in a Supported Employment Environment. Individuals with autism face a variety of problems and have less engagement in daily activities than their non-disabled peers. Research has been done on the long-term impact of vocational training and experiences, including improvement of self-esteem, skill gains, income, and overall quality of life. Supported employment has been proven to be more beneficial than sheltered employment. Supported employment in this research is defined as working in a community-based location with the support of a job coach. Individuals with autism commonly work in sheltered workshops, which are not community-based. Although this option provides an individual with work experience, they often make much less money and have less exposure to the community. Adults with autism are generally underemployed and often lose their jobs due to lack of production. Roughly 80% of all terminations in community-based positions result because of lack of production. A variety of strategies have proven to be effective with individuals with autism, including social stories, reinforcers as antecedents, picture cues, and self-monitoring. Based on literature review and the corresponding need resulting from it, I've developed the following research question to guide my study. How can the use of visual strategies promote work completion in young adults with autism in a community-based, supported employment setting? For this study, 3 participants were used. The first one, participant A, is a 20-year-old male with educational autism. He is mostly verbal and enrolled in special education transition program. During the past 10 work shifts at a local olive oil store in which he bottles olive oil, he has 6 significant refusals in his past 10 shifts. For this purpose, a significant refusal is a refusal to work for at least 15 minutes at a time. The second participant, participant B, is a 19-year-old female with educational autism. She is also enrolled in a special education transition program and has 8 significant refusals in the past 10 shifts. The third and final participant is a 21-year-old male with educational autism, enrolled in a special education transition program, and has had 7 significant refusals in the past 10 work shifts. The study was conducted in the natural environment for the students, which is a local olive oil store that all 3 participants work train in. A clicker was used to keep track of the number of bottles that were filled during a 30-minute work shift. The other visual strategies used during the intervention were social stories, personalized reinforcer images and reinforcers, visual countdown strip, and a visual timer. In the study, the independent variable was the package of visual strategies. The dependent variable is the number of olive oil bottles filled in a 30-minute work shift by each participant. Response was measured using count by the clicker mentioned previously. IOA was taken on 50% of trials, and procedural integrity was also taken on 50% of trials. IOA and procedural integrity was taken by a secondary staff member who sat out of sight at the back of the room. In order to determine the social validity of this study, a questionnaire was given to 12 total participants. These participants included 5 special education transition level teachers, 5 parents, 3 of which were parents of its students that were involved in the study, and 2 local business managers and owners, one of which was the manager of the local olive oil store in which the students work trained. For this study, a changing criterion design was used. A mini reversal or a bidirectional change was used during one subphase per participant in order to show experimental control. The bidirectional change in the subphase lowered the criteria to a previous level, then was reversed back to a higher level of responding. During baseline, each student went through their typical pre-work routine, which involved putting their stuff away, washing their hands, and putting on their gloves. At the beginning of the baseline, staff stated time to work once they were at their appropriate station. Verbal praise was given if student filled an olive oil bottle. No other prompts or supports were in place during baseline. After the end of a 30-minute work period, the student was instructed to throw away his gloves, wash his hands, and get on the bus and return to school without any reinforcement after their work shift. During the intervention phase, each student went through his or her typical pre-work routine. The staff asked the student what they wanted to work for. A visual choice of 3 reinforcers was offered. The reinforcers came from previous reinforcer assessments done with the student, case manager, and parents. The staff then read a social story to each student depicting what was expected and how many bottles were needed to be filled to earn that reinforcer. The picture of the reinforcer was kept in view of the student during the entire work shift. A countdown strip was set to the appropriate number of what the criteria was set to during that shift. For example, if the criteria was set to 2 bottles, the number 2 was put on the countdown strip. A visual timer was set for 30 minutes and verbal praise was given upon successful completion of the bottle filling. If the student met the given criteria, he or she was reinforced with the chosen reinforcer for 15 minutes. The student then returned to school once the 15 minutes was up. Participant A's baseline responding was low and stable. Once the intervention was put into place, the level of responding increased in a stepwise fashion with exception to the mini reversal. As shown in the graph, the participant's intervention responding increased systematically while continually reaching the criteria set for him. Participant B had similar results to participant A. Her level of responding during baseline was low with 3 cases of complete refusal. During intervention, her responding increased in correlation to the changing criteria in an upward trend. Participant B's responding followed the set criteria during intervention. Her mini-reversal phase lasted 4 sessions, all of which she met the lowered criteria. She was then able to meet the higher criteria once the bidirectional change was removed. Participant C had 4 cases of complete refusal during baseline. During intervention, he steadily increased his rate of responding in an upward trend, filling more and more olive oil bottles as in correlation to the set criteria. Participant C's results mirrored both A and B in that his responding steadily increased in an upward trending fashion during the intervention phase. Participant C also responded favorably to the bidirectional change set on trials 14 and 15. For this study, both IOA and procedural fidelity was set at 100%. For social validity, all participants recording the questionnaire rated a 5 on all 5 of the questions, deeming this study socially valid. The described package of visual strategies had a clear positive impact on the dependent variable, which was the amount of olive oil bottles filled. The students met responding criteria and, as predicted, responded to the bidirectional change, showing complete experimental control. These results support previous literature on the effectiveness of visual strategies. This research extended to employment settings. Limitations to the study include possible internal validity threat of maturation, and that the tools were all used together. Future research should be completed to determine the effectiveness of each tool individually. Future considerations for research are listed as follows. It should be determined which individual strategy has the greatest impact on an individual. It should be determined how these strategies could be applied to other vocational-related skills, such as interpersonal skills, which is also an extremely important skill in maintaining paid employment. It should be determined how can it be applied to students with disabilities other than autism, including Down syndrome and specific learning disabilities. Is this procedure more or less effective in people outside the 18 to 22 age range? It should be determined if these strategies are just as or less effective in ages 0 to 17 and 23 and beyond. Finally, it should be determined how the intervention can be faded in order to promote greater independence in the workplace for these students.